Today is it's a special day for us because this has been quite a few years in the making. We have been trying to put on a conference for a while and then lockdown, and then we started to move over here in 2020. And then I think we got the second lockdown, so it's taken 4 years to get here, but we're finally here. We've literally just about moved in. So we thought, why not, celebrate it with something like this and just welcome everybody to what is going to be a really special day. So I'm going to be chairing the conference all day, so I'm not going to say too much this morning because I want to introduce our first speaker. I'm really excited to hear, where is Rosemary? So we have Dr. Rosemary Nyabadza. Rosemary is a GP locally, and she has started to explore over the past few years integrative health, training as a health coach with us, which has been a great experience for us as well. Learning so much from Rosemary, and also functional medicine. Rosemary's going to talk to you about, the integrative health model. So welcome, Rosemary.
Hi, everyone. Oh, thank you. I'm Rosemary Nyabadza. I'm a GP in Manchester. I practice at the Manchester Royal Infirmary Urgent Treatment Centre, which is very different to integrative health. I came to integrative health through my own health crisis, which is, I think, what a lot of people do, is realizing that health goes beyond what we were taught in medical school. And actually, what we're taught in medical school is all valid, and I have a lot of respect for it. But there are gaps in it that one only realizes with the wisdom that comes with experience. So when I went through my own health crisis, I thought about, I knew what my GP would be able to offer to me, and I knew that's not what I needed. And so I didn't even go to the GP. I went to the Chinese doctor first, who really helped me with acupuncture and herbs to get everything flowing again. And then I had to go on the journey of questioning for myself how I had ended up in this situation where I had had this accumulation of thoughts, feelings, and behaviors that had ended up manifesting in the health problem that I had. Someone said to me recently that Eastern medicine looks at health from the point of view of vitality, and Western medicine looks at health from the point of view of death. And when I sat and thought about it, it made sense that, we get to medical school, and the first thing you do is you walk into an anatomy room and you look at cadavers, you look at prosections, you look at dead things in order to try and understand life. Whereas in Eastern medicine, they have spent thousands of years spending time going inwards to try and understand what makes them feel more alive, what contributes to a sense of vitality and connection to that which expresses itself as life within us. And I think the difference between those 2 points of view is what informs how we see those medical practices showing up in day-to-day life. And that's why I feel that Western medicine really needs to learn to open itself to mystery, to magic. As Elaine mentioned, we're in a very magical place right now. To not needing to know why things happen all the time, not needing to factually understand or scientifically understand why someone is feeling better, for example, but maybe just to have gratitude that they do feel better. So to let go of this need to be right, this need to validate according to Western scientific methods, which often then says that other methods or other ways of seeing the world or looking at the world are invalid, which I find now quite a disrespectful way of moving through the world. But I was very much like that, and I like to tell people that, I used to have women from Southeast Asia coming into my GP surgery, and if they had a cut on their finger, they would have some yellow smeared on it, and I'd say, "Oh, what's that?" And they'd say, "Oh, I've just put some turmeric on it." And I would say, "Oh, that's not going to work, that's not going to help." And now the first thing that I do if I get a cut or a scrape is to put turmeric on it, and we know that it's got amazing anti-inflammatory properties. And so it's this sense of humility and this sense of not needing to be the one who is doing or not needing to be the fixer, but rather to put ourselves in the position of a facilitator, a channel, and a connector, which then shifts the whole relationship between doctor and patient or practitioner and client, where it becomes a collaborative journey of intimacy and of people relating to one another, rather than this hierarchical us and them power dynamic, which often happens in medicine. And so I find that integrative medicine is a celebration. It's truly a celebration of life, of vitality, of what it means to spend these, if we're lucky, 80, 90 years upon this planet before who knows what happens next. And to be able to dive into the privilege of being alive, while also having the freedom and fun and liberation to be able to move within that without feeling too pulled down by the gravity of the fact that 90 years is actually not that long. And so in the spirit of celebration and the spirit of integration, I am going to celebrate in the way that we celebrate in my country, which is to ululate. Woo! 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 And I ululate with this building. I ululate with the magic of this building, that we are here together celebrating life and trying to understand what it is that is the magic of life, and how does this interact with the structures around us, this building, the nature around us, Gorton, and everything that is happening in the world, and how do we place ourselves and our health within that, and how do we see that correlated in things that are supposedly external to us. And the reason it was so important for me to celebrate in the way that is natural to me is because, I'll tell you a little story, but when I was at medical school, I was at the trembling medical student, presenting her first patient to a consultant at the John Radcliffe Hospital in Oxford. And I was standing in the corner saying, okay, so I have to remember the presenting complaint, the history of presenting complaint, the social history, past medical history, all the medicines that this person was on, and really in my head about all these things that I needed to remember. And this very kindly consultant who was wearing a bow tie came and he stood in front of me and he said, okay, Rosemary, go ahead and present your patient. And I started to present, and about a minute in, he said, oh, stop. Now, start again and do it again with your hands behind your back or clasped in front of you. And the implicit message that I got from that, being a girl from the Sunshine City in Zimbabwe, Harare, was that your sunshine is not welcome here. That you need to be more like me in order to be valid as a Western medical practitioner. And so it was this kind of conditioning that led to a fragmentation within myself of what it means to be a doctor. And what was funny was that the sunshine could not be held back. And so when it peeped through in exams and especially when I was with patients, it definitely couldn't be held back then. And that is what I was then most commended on, not my scientific knowledge, not my remembering exactly what dose needed to be prescribed, but the humanity, the connection that shone through. And yet the message that I had received implicitly, and I don't think he was trying to be helpful, was that the fullness of you is not welcome or will not be welcome to everyone. And it's this kind of fragmentation that we all experience throughout childhood, actually. It's this fragmentation that comes with conditioning. It is the nature of learning, where other beings impose or impart their wisdom or their beliefs on us. And those beliefs and thoughts end up becoming our beliefs and thoughts, and our thoughts become our behaviors. And our behaviors can end up manifesting in the health behaviors that we have, and therefore our health problems and manifestations later on. And also our behaviors are what create the world that we see around us. And it is this fragmentation, which can be called trauma, sometimes with a big T, sometimes with a little t, but it is anything that pulls us away from who we truly are, who we were born as, the fullness of that. And that kind of repression is what makes us feel that there are parts of us that are unwelcome, parts of us that are too much or too little or not worthy of being seen, not worthy of being in the light. And it is these parts that are often child parts, inner child parts, that through the journey of life, as we learn to reintegrate them and to nurture them, that hold great promise, great creativity, great potential, and great freedom as well. But if we continue to repress them and continue to be in that fragmentation, it's also those parts that in their place of exile, where they are hidden away, begin to show themselves in ways that may not be so harmonious to the rest of the system. And that can be through activities and behaviors that soothe them, which often are immediately soothing and absolutely fine in moderation. But if that becomes habitual, become the accumulation that then leads to diseases. For example, self-soothing behavior could be reaching for a glass of wine or a donut or a cigarette. And actually, once in a while, that's exactly what you need. But done repeatedly over a course of time can lead to cardiovascular disease, to cancer, to inflammation, and to downstream diseases. And this is what the Chinese and Indian Ayurvedic system have known so well, is this concept of accumulation, where repeated behaviors that are done over a course of time can result in disease. Western medicine is only just waking up to prevention and primary prevention, but we're still very much stuck in looking at things from a numbers point of view, like primary prevention. What's the blood pressure? How do we bring it down? Take this medication. Exercise, blood sugars. So we're still very much focused on looking at things and people through the lens of numbers, as opposed to saying and encouraging people from a very young age to access that which is vital within them, to access that which lives within them, and to be so intimately connected with what is happening inside that we can tell, oh, when I do this, when I go for a walk, when I go for a run, when I eat a salad, I feel better. And then to encourage people to say, if you feel better, if something that you do makes you feel better, do more of it. And not if something that you do makes you feel better, like having a glass of wine or a cigarette makes you feel better, but if something that you do that is nourishing and nurturing and promoting of vitality, if it is a life-loving thing, do more of it. And if you are compelled to do things that do not promote that which is alive within you, then without judgment, actually with a lot of compassion, can you sit down with that part of you that feels the need to reach for, a bottle of vodka a night, and can you ask it what it needs, what you can give to it, where it came from? Can you go into that deep conversation with yourself and ask yourself, these child parts, these ones who are fragmented, who have been cut off, where they come from, what they need, what they would like to do. And this is where listening, this is where being heard, sometimes by somebody else. And this is where the things that doctors aren't very good at and definitely cannot be done in 10 minutes in a GP surgery, this is where true healing comes. Because if that part that reaches for the bottle of vodka can be given the space to reintegrate into the system, then the liver cancer 30 years later is not going to happen. But that coming to terms with the story of ourselves and also the historical stories that have led to this experience that we have had called life, and the experiences that that cause our fragmentation, if we can connect with those stories and be the ones who rewrite those stories within our own lives, then we become the narrators, not just the narrators, but the protagonists in our own stories. And we become the ones who integrate the past, because whatever has happened to us that has led to these behaviors which are born from thoughts and feelings has also happened to the people who imparted them to us, who conditioned us. And so by integrating that within ourselves, we actually heal them. We heal our ancestors and those who have come before, who did the very best they could, but they could only do it up to a point. And then we become the ancestor for the future generations who are able to change things, where the next generations don't even know that this was a pattern in our family because it stopped with us. And so this is how integrative medicine helps to not only heal ourselves, but that healing then extends automatically into the community through our families, to the people who we are around, and it literally, like that halo effect that Elaine was talking about, ripples out without any effort needed on our part, apart from being able to come inside and be with ourselves, to be present with the pleasure and the pain of being a human being. And it is really tough to be a human being. And it is also really beautiful and such a privilege to be able to experience the highs and the lows, the dark and the light, the whole experience without judgment, and then be able to approach all the people around you with that same level of empathy and understanding, because we are human. And this changed my life as a doctor, because I was doing this robotic medicine. I was, standing with my hands behind my back and, just being who I thought a doctor needed to be, until I had this moment of health crisis where I was forced to meet myself. And part of that was learning to be authentic with my patients. And so suddenly I found myself wearing different clothes, literally deconditioning all these ideas about what I thought a doctor was supposed to be and who my patients wanted me to be, because I realized that they wanted me to be me with them. And so I changed the way I dressed to work, I changed how I just became me. And suddenly the consultations got easier, we were connecting, I was prescribing less, we were following up and seeing huge transformations happening, just because I had allowed myself to get off this high horse of being the fixer, being the doctor, being the one with the 7 years of medical education behind her, and allowing myself to become a human being interested in another, and actually to be healed by the person sitting opposite me, because often I found that many of the things that they were coming with resonated with me within my own system as well. And so it was this sense of cooperation and connection and intimacy and vulnerability that led to amazing health outcomes, and then made me realize that actually I know very, very little, which is why I then moved on to training as a health coach to learn the nutrition that I learned nothing about in medical school. And yet, food is medicine, and food is used as medicine in so many other wisdom cultures, and should be the primary place from which we help people to connect with themselves and their bodies. I also learned about movement and also the spiritual element. So these things that Western medicine doesn't understand, it just kind of puts blinkers on and says, no, it doesn't exist. I realized that, wow, there is so much that we were missing out on. We were not taught very much on spiritual care for people, because I think it's just too much for Western medicine to fathom. There are so many different ways of approaching spirituality and belief, and how do we do this? So let's just put it away. And yet it is through spirituality, and it doesn't have to be anything that is directed or defined, but actually allowing yourself to be a conduit once again for the person in front of you to go on their own journey within, and to give them just a little bit of an idea that through connecting to spirit, magic, that which we cannot see, that which is a mystery, that which maybe in 100 years' time we'll be able to write about in a journal. But even though we don't understand it now necessarily in a way that we can do a randomized controlled trial, doesn't mean it doesn't exist, and doesn't mean that we cannot embrace it and still use it. For example, I think of Tai Chi when I'm saying this, in that in many wisdom cultures, movement medicine and meditation, such as Tai Chi, meditation practices, and yoga, have been shown to help people with their health, to get the energy channels moving, and to get people connected with the mystery of life, which then helps them to understand the potential for healing that is present, that goes beyond what the mind of any doctor or human being could say. And so to give people that opportunity to explore for themselves the wholeness of what they are beyond what is physical, and possibly to give them the realization that, if you want to call it placebo or miracles or whatever, it doesn't matter what we call them, but that there is a mystery out there that can be harnessed, that we all have access to, and that manifests itself in many different ways and in different layers, including just through the food that we eat. That we can then become more in touch with what it means to be a human being. I had slides, but I'm just flowing with what's happening right now. So let me have a look here. Okay. So just to tie it in a little bit more with the Western medical approach. So I was talking about how this fragmentation, which can happen in childhood, then leads to health behaviors that can accumulate into disease. Not only can it lead to health behaviors that accumulate in disease, but actually the stress itself that comes from fragmentation manifests in the body as increased stress hormones such as adrenaline and cortisol, and those have downstream effects such as increasing the blood pressure, which will then put a load on the heart, which can then lead to cardiovascular disease, and also to inflammation. And more we are realizing that many diseases, particularly of lifestyle and cancers, are driven by inflammation in the body. And this is why working with some practices such as meditation, yoga, Tai Chi, that help us to access the rest and relax side of our nervous system, and to learn not only to practice with it, but actually to realize that even though this is the autonomic or automatic nervous system, we, through having an intimate connection with ourselves, can become the ones who modulate what we need when we need it. So sometimes we do need that fight or flight, sympathetic, let's get out of here side of things, but we don't need it when you're responding to an email from your boss. And if that is activated all the time, that's when it leads to stress-related diseases downstream. And so for me, when Christian was doing the sound journey early on, and I had a part of me that was feeling quite nervous about getting up here, it was such a wonderful opportunity just to drop back into my body, drop back into trusting the space, trusting you, trusting the message, trusting the building, that actually this isn't even about you, Rosemary. Like your ego, or the parts of you that are thinking that, who's going to be looking at me? Am I going to say the right things? Those are the parts that are getting stressed right now. But if you can just ask them, validate them, yes, they're valid, but they don't need to be the center. And if you can just ask them to sit aside for a moment and allow the trust in life to carry you, then it will happen as it does, which is why I haven't even changed slide now. So, okay, I don't know how much time I have. That's time, okay. And just to end, I will say that integrative medicine is truly about harmony, and it's about harmony within ourselves, within our bodies, so harmony within each cell, harmony within the organs, harmony between the organs, and then harmony that ripples out to our relationships, our work, our world. And this is how we change the world. As Gandhi said, be the change that you want to see, and it all starts within. It all starts with loving ourselves and going on the journey to intimacy within. So thank you.